Okay, so we've made it to the Indigenous Curriculum Approaches and Strategies page. Lots to discuss on this. Indigenous teaching approaches and learning are more than about differences in perspectives, but are focused on the relationships Indigenous peoples have with the universe, the Creator, and the land. As a result, both the educator and students are to surround themselves in this process of learning and developing through Indigenous epistemologies. Indigenous educator involvement is vital in the design and implementation of health curricula, facilitating culturally appropriate, equitable, and inclusive practitioner training programs. And I mentioned this a little bit in the last page. In addition, these programs should include open dialogue between learners and Indigenous educators to promote cultural humility and cultural safety, and should involve aspects of empowerment and leadership. 4 approaches are recognized as valid practice strategies within practitioner training. The very first one we'll discuss is transformative. So the transformative learning acknowledges that learners should be active members rather than passive recipients. It consists of perspective transformation and is a self-direct practice empowering self-efficacy. Hatcher et al. Add that it's also a form of cooperative problem solving and an artistic development where learners can make connections through personal and meaningful experiences. Now, one example that this can be achieved is through critical reflection, in which learners can identify and assess key assumptions on which their perspectives are constructed. This allows them to differentiate various aspects, become open to others' point of view, and integrate differing dimensions of their experiences into more meaningful and holistic relationships. It also helps them bridge the gap between theory and practice. So this can be achieved through reflective journal, which is one example, through critical reflection. And this is where practitioners can record their thoughts, express themselves through personal views, think critically and creatively, and identify, analyze, and critique their feelings and performance. Now, another example that stood out to me when I was reading the Laval article was the concept of a symbol-based reflection, which is actually more of an art-based approach. Now, this exercises participatory action and it enables a different way of thinking and understanding the significance of Indigenous practice and teaching. In this particular example, practitioners are asked to reflect and pick a sacred symbol, which could be traditional song, story, teaching, or anything that really pertains to the specific Indigenous culture on which they are being educated. Next, they are asked to reflect on that symbol and how it influenced them and think critically about how it reflects within their discipline. So for this particular example, healthcare. The educator would ask them to recreate this symbol with an art form of their choice and eventually share that recreated symbol in a sharing circle. Now, one example of how someone could possibly turn a spiritual art form into a physical one is that one participant within her article actually created a soapstone carving of a man with a braid in a taekwondo uniform holding his spirit energy at his belly, and that photo is represented within that section there. So the next one is an experiential approach or experiential approaches. And an experiential approach is a hands-on learning experience that allows for direct engagement and building new knowledge. As a result, it allows for greater transference and application of new skills. Now, this approach presents 2 practice strategies. So there's land-based learning and then there's narrative learning or storytelling. The land-based learning fosters individual and collective empowerment for students by embedding them in a land-connected learning and building social relationships through education. Now, this totally beats the Western approach where, they teach in a lecture room or more of a confined space. And the narrative learning is an effective way to teach non-Indigenous learners because it integrates the voices and experiences of Indigenous peoples through active construction of the learner's own knowledge versus Western teaching in lectures and presentations. So one example of experiential approach, and this was mentioned in my group-led seminar as well, and I really liked this example that was presented by one of my peers, was the Keros blanket exercise. Now, this activity involves sharing the history of Indigenous peoples and the impacts of colonialism and their land, as well as the beginning of the journey with their newfound illnesses as well. So, what consists of this activity is that the practitioners step on the blanket, and the blanket itself represents Indigenous peoples on the land, or the practitioners represent the Indigenous peoples on the land, which the land is represented as the blanket, and that will be represented before the settlers arrived. So as the blanket is being folded piece by piece, each piece represents the deterioration of Indigenous land, language, culture, traditions, and the degradation of the land from industrialization. Now, according to Eker, this exercise incorporates narrative and emotional components within its teaching practices, and it is carried out by Indigenous leader. The image has also been linked to the website to learn more about this practice as well. So again, just click on the image and it'll bring you right to that website there. And it has a little video on their website that kind of more illustrates how the activity goes on. The next thing we're going to talk about is strength-based learning or approaches. Or practices in this sense. And so using strength-based practices is used to reveal the gifts that we have to show humility, reciprocity, and respect. Now, I've provided a button that says strength-based action strategies, which will also bring you to a table that will share 4 directions in which this can be practiced on page 434. So you just have to go to the article, go down to page 434, and you'll see a different kind of table that has the 4 directions. But I'm going to briefly explain it in 2 seconds here. So the first direction is enacting gifts by focusing on positive attributes that facilitate well-being with Indigenous peoples. The second one is upholding relationality by centering good relations with Indigenous peoples. And one example could be applied to practitioner training by humanizing interactions with dignity and respect. Now, the third is honoring legacy by restoring self-determination with Indigenous peoples, which an example for this one could be respecting Indigenous ways of being, knowing, doing, and identity. And then the last one is to reconcile the truth by attending to structural determinants of health with Indigenous peoples. An example for this one within training could be engaging with cultural humility and structural competency for ongoing co-learning. Now, as you can see, there is an image below as kind of an additional representation of health practitioner education reflected in interconnected action strategies to support Indigenous health equity. The last one we're going to discuss is person-centered care. Now, I'm sure you've heard of the phrase patient-centered care, but Goodwin mentions that there's actually been a shift in terminology over time from patient-centered to person-centered care to better encompass the needs of and preferences of the person in care that go beyond the clinical or medical sense. In addition, this type of care has the ability to shift a more Western-focused healthcare model of which the healthcare practitioner is the primary decision maker to more of a model that actually supports the patient or person's choice and autonomy of their approach to care. Now, person-centered care can be applied to Indigenous curriculum through social, political, cultural, and historical realities when treating Indigenous patients within the context of colonialism and social exclusion. It can also be applied within Indigenous education and training practitioners through teaching certain principles that contribute to their understanding of and commitment to providing this type of care into context. This includes consistent recognition and maintenance of the person or patient's autonomy. So this type of training will also support Indigenous patients' informed decision-making and self-determination. For instance, according to Logan et al., Indigenous patients were more likely to build trust when practitioners asked them if they wished to participate in Indigenous healing practices as their form of treatment. The relationship between the practitioner and the Indigenous patient could also greatly benefit if the practitioner is willing to learn about traditional medicine and healing practices and form a more collaborative treatment approach that included elders or healers or knowledge keepers.